Hi everyone, Wendy Trevarthen here, and welcome to episode 1 of Your Nurse Voice Matters. I thought I would dedicate this first episode to introduce myself there to the world. And you know what, when I thought about putting this together, how am I going to talk about myself for 20 minutes to keep you entertained and also to give you a flavour of what my philosophy is and why I've actually launched into doing this podcast for nurses. So I came down to 3 things rather than give you a curriculum vitae on the air. I thought I would do this in the form of the 3 key themes of this podcast. Firstly, inspiration. Secondly, education. And thirdly, advocacy. And I can describe my career along those 3 themes, and I'd like to weave in and out some experiences and stories in amongst that. I reside in beautiful Brisbane. I've lived here for 12 years now with my beautiful partner, Nigel, and my daughter lives nearby with her twin granddaughters. My son is in Sydney in the Navy. I've spent 36 years as a registered nurse. I retired just 2.5 years ago, and you hear more about that story shortly. But throughout my career, nursing has been the backbone of my blood. It's been in my DNA. I've thoroughly enjoyed my career, and I wanted to move into the latter part of my career, fostering well-being in others in another way besides nursing. And I'll move into how that transition came about. My inspirations for my nursing career came from a number of sources. When I was 17, my dad, who was in his late 40s at the time, developed a disease called Guillain-Barré syndrome. And it was his exposure, this was back in 1983, it was his exposure to this disease or this condition that introduced me to the wonderful world of healthcare, and in particular, the dedication and the inspiration of role models that he received in his nursing care during particularly that time in ICU. I saw nurses that went above and beyond to support not only Dad, but us as a family unit, extended family unit during that time. He was on a ventilator for 14 months and then transitioned from ICU to the medical ward and then was transitioned home. And Mum had a complete pivotal turn in her life to be able to become his full-time carer. And she was an inspiration because she went from being a private secretary to being a full-time carer for Dad. But the whole experience as a 17, 18, 19, 21, 22-year-old for me was daunting. It was life-changing. And I was moving on in my life as well as Dad and Mum moving on in theirs. And my older sister, Anne, who you'll hear in a later episode, moved on with their lives as well. So everything happened in parallel. There were peaks and troughs and there were different things to manage. But my inspiration purely to enter nursing came from that whole entire experience. I hope that my 36-year career is an inspiration to people out there, to other nurses and also the general community. I know I've given a lot of my time and effort into nursing and aspired to achieve great results in my career. It didn't start off being that way though. I left year 12 and didn't really know what I wanted to do. I sort of buzzed around for 12 months until I decided that nursing was what I wanted to do. And when I made that decision, nursing for me was in a hospital-based setting. It was a 3-year apprenticeship, and then we learned in the school, and then we went out and practiced things in the ward area or in the clinical environment in parallel to what we were learning. And it's such a contrast to what we are seeing today. Later in my career, I spent time as a clinical facilitator, so I got to see the contrast of their training versus what we did back then. And to be honest with you, my personal opinion, I actually think that we had a better rounded course, a greater application to the clinical environment, and we learned on the job as well as in academia world. And it was those practical skills that really embedded the connection with the patient and the family that was a part of my values as to why I chose nursing as a vocation. I didn't do a graduate year. I went on and because I had to relocate from Victoria where I trained back to Tasmania where I grew up, I got a position on the burns unit, and that was really interesting. We looked after babies right through to the elderly within the one unit. So the diversity around that was a great experience. A part of that burns unit experience, we had to spend 6 weeks in ICU learning about airway management for an extensive burns case. And during that ICU experience, I did a bit of self reflection that ICU, because of the experience that I'd had with Dad, wasn't an area that I felt comfortable with in pursuing as a career avenue in my nursing vocation. So ICU, ED, surgical was not on my repertoire. I knew that I wanted to have the challenge in the medical area, and I found my way from the burns unit into the oncology arena, and that catapulted a 15-year involvement with cancer nursing throughout my career in a number of states, number of opportunities, even overseas. I studied at the Royal Marsden Hospital for radiotherapy nursing and really enjoyed that experience. Went on to be a nurse educator for a time, and then in middle management in rehabilitation and managing a ward environment through a couple of wards that I had experience with. From there, I was a high achiever, always a high achiever at school, wanted to do the best that I could, and I aspired to become a nurse practitioner. I went on to do 2 years out of the 3-year program as a nurse practitioner. But unfortunately, as I say, the goalposts moved to afford me the opportunity to complete those studies. My area that I was heading towards was post-treatment side effect management for patients, particularly with undertaking radiation therapy. So that opportunity was not afforded to me for a variety of circumstances, and I do write about that in my third book. But it also exposed me to the nature of the healthcare system that we do work in. It is a large business organisation, and they do change their goalposts. But I don't feel that the studies there were wasted. They were adding to my knowledge and adding to my critical thinking about more things than just, doing an assessment and doing a treatment plan or anything like that. It was more a holistic approach that really gave me the depth of understanding about the healthcare system. With my education throughout everything that I did, I always, and I pride myself on this, I always took the time to speak to other nurses, junior nurses, colleagues, and senior nurses with the view that we were working together for the good of the patient. And that sort of mentoring and guidance, I feel, was one of my strengths during my experience. I went on to do 2 postgraduate certificates. Back when I was doing cancer nursing, I did the cancer nursing postgraduate certificate. And then later in my career, I took 6 months off work and did a postgraduate certificate in healthcare education. And that was a really good program because it went across all disciplines. I was studying with physiotherapists, occupational therapists, social workers to develop their areas of expertise in a program development over 6 months. And I did this really complex activity to develop a program for transitioning nurses from acute care into community. At that time, I'd had some experience in community nursing across 4 sites in Brisbane, and I could see the differences from a nurse coming from another setting into community. It was a huge leap of faith and a huge difference. You went from being in a controlled ward environment to being in community where you're very autonomous in your decision making and working together with the extended team. That experience for the 6 months really exposed me to the opportunity of applying that knowledge into developing further programs and moving into what I'm actually doing with nurses at the moment. It was during that time too that I did some time as a clinical facilitator, and it was almost like an epiphany that came upon me in comparing my own experience as a student nurse versus what I was teaching at the time. I'll give you an example. So when I went through many years ago, we had a cohort of 18